I've hurt my back. Do I use heat or ice? This is a question that I'm asked time and time again here at Spinal and Natural Healthcare. And although there is no hard and fast rule, I tend to suggest the following based on simple physiology. In general, when an injury first occurs, I would suggest using ice. And this is also the rule for an injury up to 6 weeks. It also applies to a recent flare-up of an old injury or one that has recently become more uncomfortable. For example, if you've had a history of back pain that comes and goes, and if whilst gardening it flares up again, then ice would be an appropriate treatment. If you've had a persistent nagging background ache for ages, which doesn't just go away, I'd first try the ice treatment for 48 to 72 hours, and then after that try a nice warm bath. So, why do we use ice then? Think of it this way. With an acute or recent injury, the tissue is inflamed, rather like burning your finger on a hot pan. Again, the question is, do you run it under hot water or cold water? Of course the answer is cold, and the reason you do this is because the burned tissue is inflamed, and the cold water, rather like the application of ice, slows the inflammation and swelling that occurs after injury. Now, most back pain is accompanied by some type of inflammation. Addressing the inflammation helps to reduce the pain. Ice therapy numbs sore tissues and provides pain relief. It's a little like a local anaesthetic or taking anti-inflammatory tablets, but without any nasty side effects. Ice therapy slows the nerve impulses in the affected area, which interrupts the pain spasm reaction between the nerves. Ice therapy also decreases tissue damage. Ice therapy is most effective if it is applied as soon as possible after the injury occurs. The cold makes the veins in the tissues contract and reduces circulation. Once the cold is removed, the veins overcompensate and dilate. Blood then rushes into the area and brings with it the necessary nutrients to allow the injured muscles, ligaments and tendons within the injured area to heal. As with all pain relief treatments, there are some cautions to be observed when applying ice. Never apply ice directly to the skin. Always ensure that there is a protective barrier between the ice and the skin, such as a towel. Limit the ice application to no more than 15 to 20 minutes. Leave at least 1 hour between applications. And ice should ideally not be used on patients suffering from rheumatoid arthritis, Raynaud's syndromes, cold allergic conditions, paralysis or areas of impaired sensation. After 48 to 72 hours, when you feel the swelling has gone down and the pain spasm cycle is broken, you can begin stretching the injured muscle with the appropriate exercises. And you can find these exercises in the relief phase of the stage 1 members area. At this point, choosing ice or heat is really up to you. Most people like heat before the exercise and ice afterwards. Either way, you're getting red blood cells to the area to promote healthy healing. I hope this helps answers any concerns about heat or ice treatments. For our clients within the centre, you may have queries or concerns. All you have to do is please just give us a call on 01268 752 123. If you're a new client, you can book a consultation and we'll be more than happy to assist you in any way we can. Thank you very much.